Hello and welcome. Today we're doing a deep dive into hypertension management, focusing on the high-yield clinical pearls and the essential counseling points you can start using at the counter, well, today. Let's get right into it.
So here's our game plan. First, we'll set the scene with the clinical landscape. Then we'll get into the nuts and bolts of diagnosis, targets, and lifestyle changes. From there, we'll navigate the drug therapies, and we'll wrap it all up where we, as pharmacists, can make the biggest difference: patient counseling and adherence.
Okay, first things first, let's talk about the big picture, because understanding the sheer scale of hypertension really highlights why our role in managing it is so critical. Just look at that number, 1.4 billion. That's how many adults around the world are living with hypertension. It is without a doubt one of the most common conditions we're going to see day in and day out in our pharmacies.
And this is really the so what of it all. This is why it's so important. Uncontrolled high blood pressure isn't just some abstract number on a screen. It has real and sometimes devastating consequences. Our interventions are what stand in the way.
And here are those consequences, laid bare. Every single prescription we fill, every piece of advice we give, it's all aimed at preventing this exact list of serious, life-changing events for our patients.
Okay, so with that context firmly in mind, let's pivot to the practical side of things. How do we actually diagnose hypertension? And maybe more importantly, what are the blood pressure targets we're aiming for?
This table is fantastic, a really great quick reference guide for the pharmacy. The key thing to notice here is how the targets shift depending on the patient and the setting. For instance, you can see that much tighter control is needed for a patient with diabetes or someone at high cardiovascular risk. This is where we really start to tailor the therapy.
Now, for any patient who is monitoring their blood pressure at home, this protocol is a critical counseling point. Simply explaining this process, especially the part about throwing out the first day's readings, ensures that the numbers they bring back to their doctor and to you are as accurate and reliable as possible for making good treatment decisions.
Okay, before we even think about medications, we have to talk about the absolute foundation of hypertension management, and that's lifestyle therapy. It's not optional, and it's incredibly powerful. I mean, just look at how effective these changes can be. A drop of over 11 points in systolic pressure from diet alone, that's often just as good as adding a whole new medication. This is such a powerful visual to help motivate our patients.
So, these are our go-to counseling points. They're specific, they're actionable, and most importantly, they're backed by evidence. Honestly, even just focusing on one or two of these with a patient during a consultation can make a massive difference.
All right, let's get into our wheelhouse, pharmacotherapy. The goal here isn't just to memorize the drugs, but to really understand how to pick the right drug for the right patient at the right time.
This is the question, isn't it? This is the most common clinical scenario we're going to face. The good news is, the guidelines give us several excellent evidence-backed options right out of the gate.
So, for that standard patient with uncomplicated hypertension, we have this whole menu of first-line classes to choose from. The final choice can really be guided by other patient factors, cost, and of course potential side effects, which we're going to get to in just a bit.
Now, this is where we move beyond the general guidelines and really start individualizing therapy. This is our bread and butter. If a patient has diabetes and protein in their urine, we know an ACE inhibitor or an ARB is the way to go. For heart failure, it's got to be an ACE inhibitor and a beta blocker. Recognizing these compelling indications is just fundamental to our practice.
This right here is a huge clinical pearl. When one drug isn't cutting it, especially if the patient's blood pressure is more than 20/10 above their target, adding a second medication from a different class is so much more effective than just cranking up the dose of the first one.
And now we've arrived at the area where pharmacists truly get to shine. Because it's not just about getting the patient the right drug, it's about making sure they understand it, they can afford it, and they actually take it correctly.
Oh, this is a pharmacy classic. A patient on Ramipril comes to you complaining about this annoying, dry cough that just won't go away. Knowing to suggest they talk to their doctor about switching to an ARB like valsartan is such a quick and effective intervention. And of course, always remember to counsel on the pregnancy contraindication for both of these classes.
This table is basically a cheat sheet for the most common issues we'll be troubleshooting. For example, if you preemptively tell a patient starting amlodipine that some ankle swelling is a common, dose-related side effect, you can prevent a panicked phone call later on and actually improve their adherence. So when you pull up a patient's profile and you see 3, maybe 4 blood pressure meds, and they're still not at target, this definition should pop into your head. But, and this is a big but
before we assume it's true resistance, we have to investigate adherence first.
Does this list look familiar? These are the real-world barriers our patients are up against every single day. Sometimes a simple, non-judgmental question like, it can be tough to remember every dose. How many days in the last week would you say you might have missed one? Can open up a crucial conversation.
And the great news is, we have a whole toolbox of practical solutions. Suggesting a bubble pack to organize their meds, or recommending a combination pill to reduce their pill burden, these are simple, effective strategies that we can recommend.
This quote really says it all, doesn't it? It perfectly underscores our role. We are not just dispensing pills, we are absolutely essential members of that patient's healthcare team, and that collaboration is what leads to the best outcomes.
So, I'll leave you with this question to think about. The next time you're counseling a patient on their blood pressure, just remember the ripple effect of your words and your advice. You're not just managing a number on a machine, you're actively working to prevent a stroke or a heart attack. Thank you for your time.